Hey, this is Dr. Bozeman with Ask the Doctor. I want to talk to you today about radiculopathy. What exactly is radiculopathy? How do you know if you have radiculopathy? Well, radiculopathy in short is basically some irritation or compression of a nerve. Out of your spine, you have nerves that exit the spine, whether it be in your cervical, which is your neck, your mid-back, or your low back, and these will travel to the arms and legs. Well, if you have compression to that nerve, you'll develop symptoms from that, and then depending on how far that process goes, you may have radiculopathy. Now, radiculopathy may present as pain, sensory changes, it may be muscle weakness, and you may see some deficits that usually are seen on physical exam. So to know if you have radiculopathy, your doctor is going to do a physical exam. They'll do a history. And based on that exam, they may want to do some imaging, whether it be something as simple as x-rays to look at the relationship of the spine and how the structure of the spine. And there may be some additional imaging such as MRI or CT. And in addition, we can do EMGs or nerve conduction studies to measure the amount of information being transmitted through that nerve itself. So radiculopathy basically is you have some insult to the nerve, and it's not to be confused with radiculitis. You can have inflammation of the nerve, which is usually going to be easily manageable, but it doesn't have to be compressing that nerve. So radiculopathy is more or less, think of a process. As this process gets worse, your symptoms will worsen. So that's what a radiculopathy is. You can have it through natural aging process, degenerative process. You can get it through an injury. We talked before about disc herniations. Disc herniations tend to be a high correlation with radiculopathy if that disc is compressing that nerve root. Now there's many treatment options for it. They range from conservative care to more aggressive, more invasive care. But chiropractic has stood well with treatment of neck complaints, low back complaints, radiating pain, and radiculopathy. Your doctors know whether you're progressing. So your treatment plan is always catered to your progress. And if you're improving, then that's great. If you're not, there's multidisciplinary approaches to care. And that's something you certainly want to talk with your doctor about. And in addition to some of the treatment plans we have, we'll have Dr. Cantor come in and talk a little bit about different protocols like McKenzie exercises, which are driven to centralize that pain and reduce the radicular complaints that you're having. And speaking of pain, we'll also have Dr. Hayes come in and talk about the importance of pain and how it plays a role in your treatment. And the misnomer of being out of pain does not mean you're well, and she'll go into much more detail on that. But keep in mind, radiculopathy is a process where you have some insult or compression to a nerve, and it's going to cause some additional symptoms, and we are well versed in looking at that. So definitely talk to your doctor if you're having any radiating pain, sensory changes, or even notice weakness in your arms or your legs. Thanks.